if you have been with someone who is having bipolar affective disorder, is that you may find them laughing, ha ha ha, yes, Musao, what? Then at the same time, you find someone crying. Okay? Did you know that some medicines, when given while having bipolar affective disorder, is that they can worsen your condition? Okay? So in today's video, I want to show you how antidepressants can trigger mania in patients who are having bipolar affective disorder. This video is good for you if you are a medical student, you are a community member who has a patient who has bipolar affective disorder, or you are a health worker and you are someone who wants to know about mental illness. Okay? So, if you are still new to this channel, I request you to subscribe because it motivates me to make more content for you. So, reason number one, how antidepressants trigger mania or bipolar 1 is that there is neurochemical imbalance and mood switching. When you give someone antidepressants, they increase the levels of neurotransmitters. Okay? So neurotransmitters are chemicals in our bodies which are responsible for carrying messages in our bodies. Okay? They affect our mood, they regulate how we feel. Okay? They are used in the brain how to regulate the mood. Okay? If you have been watching my videos, I've been explaining what are the causes of mental illness. Is that there is what we call chemical imbalances. So when these neurotransmitters are so much in the body, you may find they affect our mood. When also they are produced in excess, they also affect our mood. Okay? For example, someone who is depressed, there are low levels of what we call serotonin. So when we give antidepressants, they raise their levels. Okay? So when we give antidepressants with people with bipolar affective disorder, we are saying that it increases the levels of neurotransmitters, meaning this person's mood is going to be increased, is going to start being hyperactive, is going to start being so much happy. Okay? Like one of the neurotransmitters which is associated with bipolar affective disorder is adrenaline. The work of adrenaline is to ensure that people can get the glucose is broken down so that you get energy. So if it is increased in the body, then you find this person has excessive energy and is moving from one point to another. Okay? Reason number 2, we are saying that rapid cycling and mixed states. Some antidepressants may contribute to what we call rapid cycling, where a patient shifts from low mood to high mood, or mixed states. If you have been with someone who is having bipolar affective disorder, is that you may find them laughing, ha ha ha, yes, Musao, what? Then at the same time, you find someone crying. Okay? Those are what we are calling rapid cycling. That someone changes from happiness to low mood, that is sadness. Okay? So some of these antidepressants are known to contribute to that kind of state. Or they can cause someone to have mixed episodes. Okay? Someone comes in the manic phase, at the same time comes in the depressive phase. And some of them, according to research, says that they can cause these conditions to come in to occur concurrently or simultaneously. That someone comes with the depressive symptoms, also at the same time comes with what? Manic symptoms. Okay? So, if you are still new to this channel, I request you to subscribe because it motivates me to make more content for you. And if you are finding this information helpful, I request you to share with other people, share with your friends so that also they can benefit from this information. The last reason number 3, how antidepressants can trigger mania or hypomania, is that there's what we are calling clinical and genetic factors. Not everyone who has a bipolar affective disorder that will get what we are calling mixed states, like switching from manic phase to depressive phase. Okay? If someone has a bipolar affective disorder, or if in the history they have bipolar affective disorder, they have what we call they had what we are calling mood swings, or they have history of switching from manic phase to depressive phase, that those factors put them at a very high risk of experiencing rapid cycling, okay, switching the moods from low mood to high mood, or from high mood to low mood. According to research, they tell us that some of these neurotransmitters, or in terms of genetics of some of these people, they are responsible for someone to have this hypomania or mania when you give them antidepressants. That's the reason, in summary, we are saying that how antidepressants cause mania or trigger mania in people with bipolar affective disorders. Number one is that they increase the levels of neurotransmitters, and remember, if the neurotransmitters have increased in the body, they increase the mood of somebody. Okay. Number two, there's what we are calling that rapid cycling and mixed states. That when we give these antidepressants, is that they make someone, or they contribute to someone switching the mood or shifting the mood from low mood to high mood. Then the last one is that what we are saying, that clinical and genetic factors, that some people who have some history of shifting their moods, if you give them antidepressants, they will make them to, it will trigger them to have what? Mania. So thank you so much for watching my video. If you are still new to this channel, I request you to subscribe. See you in my next video.